In modern life, fruit has long become an indispensable part of a healthy diet. They provide vitamins, minerals, fiber, and many antioxidants beneficial to health. Especially for people with high blood pressure, a scientific diet is considered the golden key to stabilizing blood pressure and preventing dangerous complications such as heart attacks, strokes, and kidney failure. However, a little-known fact is that not all fruits are good for people with high blood pressure. Some fruits, if eaten in excess, can unintentionally become a burden on the cardiovascular system and even cause harm when combined with medication. So, which fruits should people with high blood pressure avoid, and which should they prioritize to protect their health? Let's join the Everyday Life channel to find detailed and scientific answers in this article. 1. Fruit needs for people with high blood pressure. How much is enough? According to the latest recommendation from the National Institute of Nutrition, 2025, a healthy adult needs about 240 grams of fruit per day, equivalent to 3 fruit units. For patients with high blood pressure, this requirement does not change much in quantity, but more importantly, in the quality and type of fruit chosen. Fiber. People with high blood pressure need about 25 to 30 grams of fiber per day, equivalent to 300 to 500 grams of vegetables and about 200 grams of fruit. Potassium, magnesium, vitamin C, polyphenols. These nutrients are especially beneficial for people with high blood pressure because they help dilate blood vessels, naturally lower blood pressure, and protect vessel walls. Need. Sugar and energy. Fruits that are very sweet and high in calories can cause rapid blood sugar spikes, leading to obesity and lipid metabolism disorders, which are major risk factors for cardiovascular disease. Thus, instead of eating as much as possible, patients need to know how to choose the right fruits and eat them in reasonable amounts. 2. Fruits that people with high blood pressure should avoid or limit. Not all fruits are friendly to blood pressure. Some fruits, although nutritious, can interact with medications or increase metabolic burden, negatively affecting the cardiovascular system. 2.1. Citrus fruits and grapefruit. A double-edged sword when used with antihypertensive drugs. Grapefruit, oranges, tangerines, lemons, especially grapefruit juice, can increase the concentration of some calcium channel blocker antihypertensive drugs such as O-nifedipine, O-amlodipine, O-felodipine. When drug levels in the blood rise too high, the blood pressure-lowering effect becomes too strong, leading to sudden hypotension. This causes insufficient blood flow to the heart and brain, increasing the risk of heart attack, transient ischemic attack, or stroke. Therefore, people undergoing antihypertensive treatment should absolutely avoid eating or drinking grapefruit, orange, or lemon juice close to the time of taking medication. If they want to use them, they need to consult a doctor to determine a safe interval. 2.2. Very sweet fruits. Risk of triggering cardiovascular disease and diabetes. Fruits such as durian, ripe jackfruit, sweet ripe mango, longan, lychee, all share the common feature of containing high amounts of natural sugars, fructose, sucrose, and high energy. Eating a lot of these fruits will cause rapid blood sugar increases, leading to long-term metabolic disorders, damage to blood vessel walls, reduced elasticity, narrowing of vessel lumen, increased blood pressure, risk of overweight, obesity, and high blood lipids, major risk factors for coronary artery disease, heart attack, and stroke. Accelerated aging due to high blood sugar stimulating glycation processes, destroying collagen and elastin in vessel walls. Therefore, people with high blood pressure should only eat small amounts occasionally and avoid consuming them in the evening. 3. Safe and beneficial fruits for people with high blood pressure. Besides fruits to avoid, there are many fruits that are truly companions for people with high blood pressure. They not only provide essential nutrients, but also help lower blood pressure and protect the cardiovascular system. 3.1. Apples and pears, the golden duo for cardiovascular health. Apples and pears contain a lot of soluble fiber, pectin, which helps lower blood cholesterol and control weight. Vitamin C, flavonoids, and polyphenols in apples have antioxidant effects, limiting atherosclerosis. Regular consumption of apples and pears helps stabilize blood pressure and reduce the risk of heart attacks. 3.2. Bananas and avocados. Rich sources of potassium that help stabilize blood pressure. Potassium in bananas and avocados balances sodium in the body, supports salt excretion through urine, thereby reducing pressure on vessel walls. People with high blood pressure are encouraged to eat 1 to 2 small bananas or half an avocado daily to supplement natural potassium. 3.3. Guava, kiwi, strawberries. Vitamin C stores that protect blood vessels. Guava contains twice the amount of vitamin C compared to oranges and also has a lot of soluble fiber. Kiwi and strawberries are rich in polyphenols, which reduce inflammation, protect vessel walls, and improve blood circulation. This group of fruits is ideal for people with high blood pressure combined with high blood lipids. 3.4. Papaya, pineapple, mango. In moderation. Rich in enzymes and antioxidants. Papaya contains the enzyme papain, which supports digestion and reduces inflammation. Pineapple is rich in bromelain, an enzyme that reduces blood clotting and prevents thrombosis. Mango, although sweet, contains a lot of vitamin C and carotenoids and should be eaten in small amounts, 1/2 fruit per day, to gain benefits. 4. Golden principles for eating fruit for people with high blood pressure. 1. Diversify. Do not eat only 1 or 2 types of fruit, but change regularly to provide sufficient vitamins and minerals. 2. Eat the right amount. On average, 200 to 250 grams of fruit per day, divided evenly among snacks. 3. Choose fresh, minimally processed fruit. Limit canned juice and dried fruit because they contain a lot of sugar and preservatives. 4. Do not eat immediately after taking blood pressure medication, especially fruits that may interact with drugs such as grapefruit and oranges. 5. Combine with green vegetables to ensure enough fiber and reduce cholesterol and sugar absorption. Fruit is a friend of health, but for people with high blood pressure, choosing the right type and eating properly truly brings benefits. Us should limit grapefruit, oranges, tangerines, lemons, if taking blood pressure medication, and very sweet fruits like durian, jackfruit, sweet ripe mango, longan, lychee. Should prioritize apples, pears, bananas, avocados, guava, kiwi, strawberries, papaya, pineapple, in moderate amounts and variety daily. A balanced diet combined with a healthy lifestyle such as regular exercise, adequate sleep, and limiting salt and alcohol will help effectively control blood pressure and prevent cardiovascular complications. If you find this video useful, don't forget to follow the Everyday Life channel to update more useful nutrition and health knowledge. A little information every day will give you more motivation to live healthier and happier. Thank you very much, and see you in the next videos.